Painful spinal disorders can severely impact your quality of life. They limit your ability to be active and can cause you to miss work. There are many different causes of spine pain. The spine is made up of 33 individual bones stacked on top of each other. It is divided into different regions: the cervical spine, neck, thoracic spine, upper and mid-back, lumbar spine, lower back, sacral spine, buttock, pelvis, and coccygeal region, tailbone. The spine provides support for your body, allowing you to stand upright, bend, and twist. It also protects the spinal cord, which travels through the spinal canal. Spinal nerves branch off from the spinal cord and exit the spine through spaces called the foramen. A healthy spine relies on strong muscles and bones, flexible joints, tendons and ligaments, and sensitive spinal nerves. Any strain, injury, or disease affecting these structures can cause pain. Injured spinal joints and/or nerves can cause pain. It's important to understand the biomechanics of the body that allow a spinal injury to occur and persist. From childhood, our pelvis can be pulled forward out of alignment, known as anterior pelvic tilt. This misalignment is primarily caused by muscle imbalances and is worsened by sitting. To compensate for the tilted pelvis, the rest of the spine increases its curvature. This muscle imbalance syndrome in the lower spine is called lower crossed syndrome, and there's a related imbalance in the upper spine called upper crossed syndrome. The increased spinal curvature puts extra stress on the joints, leading to premature breakdown and degeneration. Fragile joints are at risk for injury. Daily wear and tear or trauma can eventually injure one or more of these fragile joints, causing inflammation and pain. The injured joints can also irritate the nerves in the spinal canal, leading to nerve pain. Understanding the causes of spine pain is crucial for effective management and treatment. To decrease spinal pain, we can decrease the inflammation with medications and/or injection procedures. For permanent relief, you will need to decrease the excessive stress on the spine by correcting your alignment. This is posture correction. It is important to understand that unless you correct your posture, you will not properly heal, in which case any treatment relief from medication, injection procedures, including stem cells and radiofrequency ablation, and surgery will be temporary until proper posture is mastered. Our definition of proper posture is standing with a neutral, upright pelvis, with your ears lined up over your shoulder. You will need to be close to your ideal body weight to be able to maintain a neutral pelvis for an appreciable period of time when you're standing. We recommend a ketogenic diet. The therapists will take 1 to 2 months to teach you how to correct your alignment. It will then take 6 to 12 months of daily stretching and strengthening exercises to correct and master maintaining proper spinal alignment. If it is too painful to tolerate exercises, or you recently had therapy with insufficient effect, steroid medication can be injected into the area to decrease the inflammation. It takes 1 to 4 steroid injections per joint to calm down the inflammation. This helps 7 out of 10 patients. If your pain improves with injection procedures, but after 1 year you have not corrected the misalignment issue, there is a 5% chance it will come back. Initially, 3 sets of injection procedures are scheduled. The procedures are spaced apart by 2-week intervals. For a disc's initial injection, only 1 level can be injected per day. For a cervical disc, only 1 side can be injected per day, but this can be done within 1 week. If the pain improves by more than 95% with the first or second injection, the following scheduled injections can be cancelled. Typically, it takes 1 to 3 injections to decrease the pain. Then you will have to take the proper steps to master maintaining a proper posture. Injections are performed at our surgery center in Citrus Park. You're usually in and out of the procedure room within 15 minutes. You're awake for all epidural injection procedures, but we do offer some IV medication for relaxation and to take the edge off the pain. For epidural and intradiscal injections, you need to be awake in order to announce if you feel pain in your arm or leg during the needle placement portion of the procedure. Procedural pain typically ranges between a 1 out of 10 to a 7 out of 10 pain level. There is a potential for short-term side effects after the injections. This includes pain or headache from the steroid medication. If this occurs, it typically goes away on its own a few days. We offer pain medication to help manage any posy procedural discomfort. Any other serious complication would be very unusual. Infections, nerve injuries, or death are very rare. These serious types of complications occur less than 1 out of every 10,000 procedures. When the spine practitioner meets you, they will discuss and review the specific sources of your particular spine problem, so that an individual plan can be made for you.